Pediatrics by Dr. Anand. Today's topic of choice is CNS Part 2. CNS Part 2. Part 2. Yes, this is the CNS Part 2, and we're going to talk about very important topic. We have just now beautifully started CNS examination. This is the CNS Part 2. Let me know if my voice is coming or not. And it's very cold in Delhi, so let me know. Okay, thank you so much for giving so much of love and support in the previous videos. I hope you guys are learning really nicely. And this is another segment. We have beautifully finished neonatology from top to bottom. We have also covered very beautifully our what do you called CNS, CVS also we have covered very nicely. I hope my voice is coming to everyone. Please put a message in the comment section that my voice is coming or not. Hey Osama, what's up? Hello everyone. So let's start this beautiful segment. And most importantly, number one, we have this NEET PG contest. We have a mind-blowing NEET PG contest, which is basically gonna happen on 23rd of January, where you will get 45 questions and you will get 60, what do you call 60 minutes you will get to answer 45 questions. And all you have to do is participate as much as possible on Jan 23 11 a.m. It's gonna be nice. It's gonna be awesome. Just 10 lakh rupees pool money you'll get, like the scholarships you'll get, 100%, 75% scholarships. And also at the same time, if you're a newcomer in the Unacademy, we are coming with a plan. If you buy the 12 months plan, you get 2 months complimentary. And if you buy a 24 months plan, you get what? You get 4 months complimentary. All you have to do is code. You have to use a code. And also at the same time in Unacademy, again, congratulations to our toppers who have worked so hard in giving exam. And now our Osama, our Ishita Srivastav and Deepak and Hamid, everyone is working so hard. Hamid, hey brother, what's up? Hamid, you don't come to the special classes, you come to the YouTube classes. अभी 1 घंटा पहले हमने 3 to 4 special class किए. Hamid, you didn't come brother, what happened? Also, I encourage everyone to give as much test as possible, because test will tell you where are you landing up in the exams. And also at the same time, we have plus subscription and we have iconic subscription in Unacademy. In the plus subscription, you get all the access to my live and recorded classes. All the amazing educators study with us together. We can watch us on your Android, in your laptop, on your YouTube, anywhere you watch us. And this is the iconic subscription where you get the Unacademy platform and also the prep ladder subscription. Also all the clinical notes, video lectures, question bank, rapid revision, treasure note, everything you'll get. Okay. So we have the plus subscription and we have the iconic subscription. And as a MBBS student, sometimes it becomes financially difficult to take a big pack. So there we have this cute, mind-blowing, super amazing code, and the code is Dr. Anand, so you can use it. And also we have the best of the best, highly effective question bank. We have made a special class feature which is exclusively for the Unacademy students. It's totally free of cost. Download Unacademy and watch me, and that's it. And also very nice, we have made a very beautiful focus FMG 2022 batch and a target NEET PG 2022 batch I have made, which is going mind-blowing. And also we have this test. I encourage everyone to give lot of tests. We have a pathology test on 28th of January, and today we had a wonderful test on ophthalmology, and we had a test on ENT. All you have to use is the code, because all these tests are logged. Okay, so that's why I'm telling you, use as much as codes as possible, and the code is Dr. Anand. Okay. Yes. यस पूजा सर, यहाँ क्लास में रिपीट करना पड़ता है क्या हर क्लास में? हाँ जी मैडम. यस, ये हर क्लास में बोलना होता है. ये एक पार्ट है हमारे सिस्टम का जो बोलना होता है. ठीक है. सो लेट्स स्टार्ट द ब्यूटीफुल टॉपिक. दिस इज द CNS पार्ट 2 and I welcome everyone on board. We have so many new people: Pooja, Nishi, Sandhu, Kalpana, Hamid, Vaidehi. Very good. So let's start. This is the part 2. In the part 1 we have already done the beautiful part of CNS examination. This is the part 2. So beautiful quote and beautiful picture of Lord Buddha, and the quote says, the tongue is like a sharp knife. The tongue is like a sharp knife. It kills without drawing blood. So a tongue is a sharp knife. It kills without drawing blood. And that is the most beautiful part of our tongue. So that is why use your tongue very, very wisely. Use your voice, use your words very, very wisely. I'm telling you, in an angry situation, we use some words which cannot be taken back and which will always be judged by the other person. which will always be judged by the other person, that you remember you said me that thing. So tongue is like a sharp knife, it kills without drawing blood. So it's a very important quote, and I want you all to use your tongue wisely. If you're not liking something, hold yourself, but don't use the tongue in a bad way. The tongue is a sharp knife, it kills without drawing blood. So remember this, and let's start the amazing, beautiful segment. This is the part two. This is the part two of the C.N.S examination, and today we're gonna talk about GCS, and then the topic will go to neural tube defects. So it's a wonderful 45 minutes, beautiful session. Let's see if you can answer me. What is GCS? GCS क्या है? What is this? Is गोलगप्पे का पानी? No. What is GCS? Anyone? Steffi? Very good. So good evening, Steffi. So GCS nothing but Glasgow Coma scale. Yes or no? We all know that, I guess. You all know that, right? We have a Glasgow Coma scale. So Glasgow Coma scale basically is divided into what? This also everyone knows. We have E, VMN, yes or no? Very good. Number one, it's a Glasgow Coma scale. Number two, it is basically done for the to know the orientation of the patient. It has three components: EVM, E for eyes, V for verbal, and M for motor. Eyes, verbal, and motor. The components of the Glasgow Coma scale are, yes. Okay, so Pooja has a doubt. What is the confirmatory diagnostic finding of RDS in a child? Confirmatory diagnostic finding is like a whiteout lung. The whiteout lung is a confirmatory diagnostic finding. Whiteout lung is seen in hyaline membrane disease or respiratory distress syndrome. What do you call whiteout lung with air bronchogram? Whiteout lung with air bronchogram is the confirmatory finding for respiratory distress syndrome in a preterm child. So GCS. GCS is nothing but Glasgow Coma scale. The components are eye, verbal, motor. And how many components do you have? 4, 5, 6. Yes or no? What is the maximum and what is the minimum score? Already Hamid has already told. Like total comes 15. The maximum score will be 15 by 15 and the minimum score will be 3 by 15. That also I already told. Very good. Very good. If you know it, let's just finish this very fast. So, and then I'll ask you one MCQ that will tell us whether you have understood or not. Okay, in this topic, we have a lot of MCQs. So let's see. So we have eyes, verbal, and motor. Eyes has 4 components, verbal has 5 components, and motor has 6 components. Total are 15 components. I, you, me, every one of us, and Pancake also, every one of us is having 15 by 15 GCS score. And the minimum is not 0 by 15. It is 3 by 15. It is 3 by 15. What happens in eyes, anyone? So we have 4, 5, 6. So if I'm opening my eyes spontaneously, you will give me score 4. If I am opening my eyes, hello, hello, what is your name? What is your name? Tell me what is your name. So by speaking and you're asking me, telling me your name, that is E3. And by pain, like what is your name? What is your name? I'm not answering, but if you pinch my skin, and I'll be like, my name is Anand. So to pain, if I'm responding my eyes, that is to E2, and no response, E1. So remember E4, E3, E2 and E1. Very, very easy. I hope you're getting it. Let's put your best of the best positive vibration for this class. I want good, happy people, happy faces and happy aura I want, so that you all can get best of the best marks in life and you succeed amazingly in life. उन्हीं का अच्छा होता है जिनका मूड अच्छा रहता है, उनका बहुत बुरा होता है जिनका मूड कड़वा रहता है. So अच्छा मूड रखें, मजे लो, ठीक है? Okay. Staphylococcus says, "Where is pancake? I'm hungry." I was also hungry. I had one Oreo shake my niece made, and I had Maggie today. So I am full right now. So eyes, is it done? This much I hope you have understood. So eyes 4, 3, 2, 1. 4 means spontaneously opening the eyes. 3 means eyes opening to speech, okay, and 2 means eye opening to pain, and 1 means no eye opening, like nothing, okay. Verbal, then we have the verbal component, again very easy. Verbal, again we have 5, 4, 3, 2, 1. If I'm orient, so verbal or response, right? One was opening response, one was verbal response, and yeah, verbal response. Verbal means if I'm conscious to time, place, and person, I am having EVM V5. If I'm oriented to time, place, and person. If I'm sounding very confused, oh my god, where I am, is this a hospital? I don't know where I am. So if I'm confused, it is V4. If I'm using inappropriate words, is this hospital, like or some words I'm using, that is V3. If I'm using incomprehensible words like hospital, what is this in incomprehensible words? I'm so bad at acting. I should not be an actor. I think I can be a good model, but I don't I want to be an actor. So V1 means no response. Yeah. Who discovered the scale? I did not discover the scale. Neither Pancake discovered the scale. If you know who discovered, please let us know. So I is verbal and motor. In the verbal V5, I'm oriented to time, place, and person. Verbal 4, I'm confused. Verbal 3, I'm using inappropriate words. Verbal 2, if I'm using incomprehensible words. And verbal 1, if I'm not responding. I'm not responding at all of whatever you're asking. Okay, I is verbal and last is motor. Motor is very easy. Motor has 6 components. Motor means, what is motor? Motor means muscle, right? Motor means muscle. Okay, that's nice. Okay, Umesh Vishwakarma, but your real videos are very good. Thank you. Today also I'll make a nice video. Don't worry. I have thought one video per day I'm gonna make, so it'll be fun. Okay, okay. Thank you. हाँ जी क्या लिखा है और okay garam and biryani. Okay, that's nice. That's nice. Okay, eyes, verbal and motor. Motor में क्या होगा? Okay, if I'm saying please touch your nose and I'm touching my nose, like if the patient is touching his nose, he's obeying commands. If I'm obeying command, please give me a motor 6. If it moves to the localized pain, if okay, where am I pinching you? You are pinching me here. So that is nothing but motor 5. Number 1, obeying command is M6. Local moving my hand to localized pain, that is M5. And flexion withdrawal, if I'm pinching you, you are like you're kind of flexion withdrawal you're doing, you're putting your hand back, that is M4. Abnormal, now this is nice, M3 and M2. Now listen very carefully in the video. Yes. Yes, so M3 is nothing but decorticate and M2 is decerebrate. Can we remember something known as abnormal flexion and abnormal extension? Please look at the video. This is decorticate, abnormal flexion, and this is decerebrate, abnormal extension. Abnormal flexion, abnormal extension. Abnormal flexion is nothing but decorticate, and abnormal extension is nothing but decerebrate. So decorticate, decerebrate. Please remember, in decerebrate, abnormal extension, all four limbs are extended. Okay, whereas in decorticate, in abnormal flexion, my upper limb are getting flexed and my lower limbs are getting extended. In abnormal flexion, upper limb are flexed and lower limbs are extended, and in abnormal extension, all four limbs are getting extended. Video got stuck. I think video is working fine. Is my voice, audio and video coming for everyone? Please put a message in the comment section, yes or no. All fine? Okay, then pray to God everything goes fine. Okay. Osama says, Pancake, your only video getting stuck. Video is okay. Is my face okay? Should I go and shave? Should I do a face wash and come? Normally I don't use face wash, and I'm like this only, charming personality. That's it. That finishes very beautiful important points of eyes, verbal and motor. After this we have what you called MCQ that will tell us exactly whether you have understood or not. What are we reading? This is the C.N.S part 2. You total 10 to 15 episodes of C.N.S will be there. We're going to cover in the January session C.N.S. We have to finish in January. So in the part 1 we covered C.N.S examination. In part 2 we are going to start neural tube defects, but before that we need to cover about Glasgow Coma scale. The maximum score is 15 by 15. The lowest score is 3 by 15. It is divided into eyes, verbal and motor. 4 components, 5 components and 6 components. Last time I'm telling, if I'm opening my eyes spontaneously, give me verbal eyes 4. And if I'm opening my eyes to speech, someone is talking to me, please open your eyes, and I'm opening my eyes. And if you are pinching my what you called hand and then I'm opening my eyes, that is IE2. And if you're pinching me doing anything but still I'm not opening my eyes, no response I'm giving you, I'm having E1. In the verbal, if I'm conscious to time, place and person, give me verbal 5. If I'm confused personality, give me verbal 4. Inappropriate words, verbal 3. Incomprehensible words, verbal 2. And no response, verbal 1. Very good. Yes. Yeah. And also Pancake has come. Hello Pancake, you are late. Kahan thi? Kidhar, where were you? Class started 14 minutes prior. You came 2 minutes prior. What is this? And I is verbal and motor. In the motor component, if I'm obeying commands, M6. If I'm localizing, telling you where did you pinch me, localizing the pain, M5. And flexion withdrawal, it's a good, this is the MCQ, okay, this one, ye na, this word comes, a patient was having flexion withdrawal. What is the EVM setting? It is nothing but M4. A flexion withdrawal is M4, and abnormal flexion, that is decorticate, abnormal flexion, and decerebrate, decorticate and decerebrate. And the demarcation point is red nucleus, above that is decorticate, and below red nucleus the lesion is decerebrate. Okay. Achha, you were having lunch. What did you had for lunch? Okay. Exactly. Okay. Fine, pancake. And also, let's do the MCQ. Let's just do the MCQ. You're the doctor in the internal ward in some college, and you met some patient, Mr. Bharat. Okay. He responses to strong pain and withdrawal his hands with incomprehensible sound. What is the GC? Let's see if you can answer this. If you answered this one correct, then I assume that you know what is GCS and you can do all the MCQs on Glasgow Coma scale. Okay. Lunch now. Yeah, that's true. Okay, Hamid. Hamid, तुम उसमें क्यों नहीं आते bro? Why don't you come to the special class, Hamid? या तुम्हारा आईडी क्या है स्पेशल क्लास का? Because I see everyone and you are always there only in the YouTube classes but not in the special classes, Hamid. Exactly. So everyone says C and someone said D also, but the best answer is nothing but 8. Matlab, option number C is the best answer. How? The person is responses to strong pain. Is responding to strong pain. To pain. Responsive to strong pain. So strong pain means 2 points I gave for strong pain. Then also withdraws his hand. Withdraws his hand. So again, flexion withdrawal. Yes or no? Flexion withdrawal. That is 0.4. So I gave 4 over here, 4 here, and 2 here. Total 6. Then also patient had incomprehensible word. The incomprehensible words, nothing but 2. So I'm writing it here. 2. Are you understanding? So 4, 5, 6, 7, 8. Total is 8. Total is 8. The total score is 8. Has everyone understood this much, that the score is 8? Please put a like button. 20 minutes are over and we have, within this 20 minutes, we have covered a very beautiful, a very simple and very sober topic of Glasgow Coma scale. Nowadays, we have updated and modified GCS scale also, where the GCS scale differs in newborns also. A lot of bifurcations are there, but at least this score, this GCS will stay like this. At least this much is something you need to understand. I will not confuse you by giving updated scores. Like this is one important score. MCQs has come multiple times from that. समझ में आ गया? Staphylococcus, Steffi, very good. Okay, nice. Steffi, in the evening you should use something else. Okay. Hamid says, I watch all your classes at night, sir. Okay, buddy, that's good, bro. I'm really happy. Okay, let's move further. So now we're moving to the next topic of neural tube defects, and a very beautiful quote. If you can stay positive in a negative situation, if you can stay positive in a negative situation, you win. You win. Very, very, very beautiful, very beautiful, very beautiful quote. If you can stay positive in a negative situation, you win. It is as simple as that. Life is just one. Either you can make your mind destructive or you can make your mind very constructive. Like I feel myself that I am, like I have so much energy in me. I read novels also, I play guitar also, I sing also, I play make videos with my niece also, I'm studying also, I'm doing night duties also, I'm teaching so heavily also everywhere. So this is what, if you can stay positive in a negative situation, you win. You simply win. This is one nice quote. And this quote also I liked. Okay, I would like to this one again. This is very nice quote, no? If you're a newcomer, like in the previous class, we had read this quote. This guy thinks it's 6, but this guy says, no, this is a 9, not a 6. So just because you are right does not mean I am wrong. You just haven't seen life from my side. So you haven't seen life from my side. So means everyone has a beautiful perspective. Everyone has their own way of living life. No one is low, no one is high, no one is bad, no one is good. Everyone is simple, nice, and equal. That's all I can say. Okay. So that's what you just haven't seen life from my side. So that really makes sense. I hope you're understanding. समझ में आ रहा है? Can we move further? Please put a yes comment so that we can move further. हाँ जी. Yes. Okay. 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 Nice. Okay, let's move further, dear. Neural tube defect. Neural tube defect, a very happy topic, a very simple topic. I'll be showing you rare of the rare neural tube defects, starting from craniorhexischisis to spina bifida, and we'll be doing some 15-20 MCQs for this topic in the next 30 minutes. Okay, neural tube defect. Okay, Sandhu, Shubhangi, we have Nirmala and Steffi. Neural tube. What is a neural tube? Anyone? What is a neural tube? Like in general, if I talk about, we will not talk about development of neural tube. That is an anatomy topic. Neural tube. What happens in neural tube and why there is a neural tube defect? What is this? Banta kya hai? How does a neural tube, like what happens? Simple one. Neural tube is a structure. It is a hollow structure from which brain and spinal cord is formed. Okay, this is a small structure. This is a neural tube where you have a neural crest. So nothing in general you should know. From a neural tube, brain and spinal cord is formed in general. Okay, and incomplete closure of the neural tube results in neural tube defects. Normally this neural tube should get closed. Normally this neural tube should get closed. If this whole neural tube is not closing, means my brain and spinal cord will not forming. Yes or no? Neural tube helps in formation of brain and spinal cord. If the neural tube doesn't close properly, there will be a defect. If either the neural tube can remain open at the cephal position, or it can remain open at the caudal position. Cephal means the proximal part, caudal means the distal part. Like cephal to caudal means from head to toe. If the neural tube is not closing properly at my head part, at my cephal part, I can lead to some entity, I can lead to some defect known as something. Have you heard of encephalocele? Yes or no? Encephalocele. Please allow, if you're a newcomer, just allow your brains for this new information. Every single entity I'll show you a picture. Okay, don't worry. Every single line I will show you one beautiful pictures and real images of the patient. Okay, even some videos are also there so that you can watch them on YouTube here. So I'll repeat again. Neural tube. Basically, neural tube is a structure from which brain and spinal cord is formed. Normally, my neural tube should close. Incomplete closure of the neural tube can result in neural tube defects. This incomplete closure can happen at the cephal part, means the front part, the proximal part, and it can lead to anencephaly, some deformity of the brain known as anencephaly. I'll show you the picture. And if the neural tube is not closing, incomplete closure at the caudal part, at my down part, at the lower lumbosacral part, it can lead to some entity known as meningocele. Meningocele. So this much roughly we need to understand. If the neural tube is not closing at the caudal part, I can lead to some defect known as meningocele. And if neural tube is not closing at my cephal part, I can lead to some defect at known as anencephaly. I'll show you now one by one. Hanji, very good. Okay, so PG entrance question number 1. Which is the most common congenital anomaly of central nervous system? What do you think? Anyone? Yes, Umesh. Very good, Umesh. Umesh is answering so beautifully. Pancake. Which is the most common congenital anomaly of the central nervous system? The answer is neural tube defect. No, exactly. Pancake is right. The most common congenital anomaly of the whole central nervous system, which has brain and spinal cord, the main congenital anomaly they can have is neural tube defect. Okay, neural tube defect. Next, very important, yeah, this is the second PG entrance question number 2. Is neural tube defect, is it a autosomal dominant inheritance, or is it autosomal, recessive inheritance? Anyone? What do you think? Is it autosomal dominant or is it autosomal recessive? That is the second PG question. What do you think? Umesh, Pooja, we have Dr. Mijash, Priya, Nishi, Sandhu, anyone? Yes, the best answer for this question, which this is the answer is, it is multifactorial inheritance. Neither it is autosomal dominant nor it is autosomal recessive. Like some cases are autosomal dominant, some cases are autosomal recessive. Best answer is it has multifactorial inheritance. Please remember, every single point I'm putting a star mark has been a PG entrance question. Okay, I hope you have understood. I'll repeat again. What are we studying? CNS part 2. We have to finish full CNS together. Okay, the full CNS. So number one, which is the most common congenital anomaly of central nervous system? The answer is neural tube defect. And is which inheritance it is? It is multifactorial inheritance. Okay, number one. What are the various types? Now this is a good question. What are the various types of neural tube defects? The various types. Number one, first I'll show you. I'll just tell you the names. Okay. First, if you are a newcomer, I'll just tell you some names, and don't get worried, don't get hassled by listening the heavy names. I'll show you the pictures one by one. Okay, right now just the names. The various neural tube defects are: number one, spina bifida occulta. Occulta means hidden. It's a very good point. Occulta means hidden. Why, sir? Why are you telling occulta means hidden? I'll tell you. I'll show you the picture. You'll get to know. You'll get to know why I'm saying it's hidden. The various neural tube defects are spina bifida occulta, meningo seal, encephalocele, meningomyelosis. Very good, Steffi. Very good. Very, very nice. Yeah. What else? What are other things you can think of? Right now, don't worry. If you're a newcomer, just listen to them. Don't write them. Listen to them. Other defects are anencephaly, caudal regression syndrome, dermal sinus, tethered cord, syringomyelia, and iniancephaly. These are just the names. I'll show you the pictures one by one. We'll finish the whole topic. Okay. Starting with the point number one. Spina bifida. Spina bifida is the first most common, or yeah, you can say the most common or the simple neural tube defect. Very good, very good. Which is the, okay, which is the PG entrance question number one? Which is the most common neural tube defect with the best prognosis? Which is the most common neural tube defect with the best prognosis? The answer is spina bifida, or you can say spina bifida occulta. Occulta means, what is occulta? Occulta means it is hidden. Yes or no? Occulta means hidden. Why, sir? Why are you telling occulta means hidden? Why it is important for us to understand that? Dear, I'm telling because spina bifida occulta, occulta means hidden, but there is a defect, but that is hidden. The patient will come, a spina bifida patient will only come with the complaints of a bunch of hair at the lower back. A bunch of hair, HAIR, hair at the lower back. समझ में आ रहा है? Is everyone understanding? I want you guys to remember each and every single word which I'm saying. Bunch of hair at the lower back, that is nothing but spina bifida occulta. Let me show you one beautiful video. This was the patient, he came to me. What do you think? Can we beautifully check this picture? Yes or no? Can we see that the tuft of hair at that lower back? Yes or no? Can we see that? Yes or no? दिख रहा है कि नहीं दिख रहा? Like, इससे अच्छा मुझे नहीं आता पढ़ाना. ठीक है? So this one, can we see that this is nothing but, very importantly, tuft of hair at the this part. This is nothing but a tuft of the hair at the lower back. Like, that's how the patient comes to us in our regular OPDs. This is a case of spina bifida occulta. A very simple, like, child with very, if you touch the spine, it's fine, no problem. मेरे को तो कुछ नजर, I don't see any problem. Only little bunch of hair is there at the lower back. This is known as spina bifida occulta. Number one. Okay, you want to see the video again? See this video. Very typical picture of, and I have my sports watch also. But now I can't wear watches because I am posted in NICU from last 1 year. So I can't wear rings. I can't wear any anklets. Nothing I can wear. No watches. Nothing. Zero. I have to be fully till the forearm. I should be having nothing. So that's it. It's done. I hope you have seen spina bifida occulta. Let's read the topic. Let's read the theory. So spina bifida occulta, it is a midline. It is a midline defect without protrusion of the spinal cord or meninges. It is a midline defect. Point number one. It is without protrusion of the spinal cord or the meninges. And usually patient is very asymptomatic. कुछ करना ही नहीं होता. Nothing you have to do. It is just a defect. That's it. Okay. And it has the best prognosis. It has the best prognosis. Rachna, this is the C.N.S part 2. C.N.S part 1, dear, we have already done on the Unacademy app. You must watch them, that one, to cover this part. Okay. Once you finish this class, what do you call it? You watch this again. Pancake, bracelet, bracelet. I don't wear bracelet. I have a very happy, good Apple Watch, but that also I don't wear. I gave this to my dad. Everything, whatever I have, I give to my dad. My shoes, my watches. My dad is like very happy. Full. Every day he's like, oh, I've got a new watch, like that. And then he ruins it and he comes back. And then I give him another watch. ये भी ले लो, ये भी ले लो. हाँ जी. Can we move further? I hope you guys have understood. It's a very beautiful, simple topic. In a very nice way, we're gonna finish it. This part is over. Yeah. Then we have something known as Meningo Seal. The next is Meningo Seal. Remember, my dear friends, Meningo Seal or meningomyelosis comes like this. Okay, like this defect, like a protrusion, like a baggy swelling at the what do you call lumbosacral region. I would like to show you the picture first. See, in my whole life, I have only studied through image-based memory. See the photo, tell the diagnosis. See the photo, tell the diagnosis. So let's watch. This is my patient only, in our patient only of Nico. Anji, can we appreciate this? Yes or no? Can we appreciate some baggy swelling at the lower back? Yes or no? Pancake, Hamid, Umesh, Rachna, Steffi, and Kalpana. दिख रहा है. This is a baggy swelling. Okay, number one. Number two, I have a video. Yeah, this is a video also. Very nice. Can you see the swelling at the baggy swelling? Little hair also. Can we see that? Yes or no? Little hair also at the lower back and a baggy swelling. Very beautiful picture. You can, so yeah, this is not spina bifida occulta, of course. Occulta means hidden, and spina bifida would have just bunch of hairs, whereas this one could be meningocele, could be meningomyelosis. I'll show you this picture of this one. 2 days back, this baby had come to our hospital. Not our hospital, it was born in our hospital itself. It's not painful, dear. No, this one was not painful. I touched it. It's not painful, but you should not touch it also. You should not touch it. Only you should call a pediatric surgeon, and then they should have a visualization of this. Okay, what is this now? Can we see that? This is more bad defect. Okay, once we cleaned this, this was the defect. This one, I can't zoom this picture, but can we see that it's kind of leaking? It's kind of leaking also. This part is leaking also. So this one is meningomyelocele. Again, remember meningocele and meningomyelocele. I'll tell you the difference first of all, and then I'll move further. Can we see? Are you able to see the pictures? Yes or no? Can we appreciate this picture? Can we say thank you to the patient first of all? Because see, your patient are your real teachers. Your patients are your real teachers. Always respect your patients. Always respect the newborns. Always respect any patient. It is just because of the patient you are learning. Okay, so they are not, उनका तुम पे एहसान नहीं है. मतलब तुम you are dependent on them. They are not dependent on you. We are dependent on the patients for the survival. Okay, that you should know. Okay, zoom नहीं हो रहा dear. ये zoom ना, इसमें zoom नहीं होता. Zoom नहीं आता इसमें. ये वो वाला नहीं है ना. This one इतना ही दिखा सकता हूँ मैं. ठीक है. अच्छा, पैनकेक एक और. Yeah, only if they respect us. अच्छा जी, क्यों? If they don't respect us, can't we respect them back? You are waiting for the patient to respect you. See, when you do something, when you love and respect someone, when you respect someone with a expectation that they will respect you back, so that is not true respect. That is not love or respect. That is a deal. If I respect, you will respect me, then I'll respect you. So take it in a light way, na? Take it in a light way. Patient is a patient, okay? He's not your family member. Patient is there. Respect them. If the patient is doing not listening to you, again, be quiet. You can tell to the higher authority this patient is creating a nuisance like that. That's it. No, you don't have to take it to heart. You don't have to take a revenge or heart to the patient, right? Okay, let's move further. Hanji. Acha. Shanti. Dr. Steffi, Dr. Pancake. Shanti, relax. That segment of stones we will talk about in another class. But right now, look at the positive side. Talk about the positive aspect. That's it. Okay? हाँ जी. हाँ जी, बस इतना ही करो. आगे तो इफ बट किंतु परंतु तो बहुत होता है, बहुत होता है, बहुत होता है. मैं बताऊंगा किसी खुले दिन क्या क्या होता है. हाँ जी. अ मेनिंगो सील. ओके डियर उमेश. अ मेनिंगो सील नंबर वन. नाउ लेट्स रिवाइज व्हाट इज मेनिंगो सील. What is meningomyelocele? Meningocele consists of CSF filled meningeal sac. Can we see that? Yes or no? This one, this meningocele, this part is a CSF filled cerebrospinal fluid, CSF filled meningeal sac, which contains only dura mater. which contains dura mater. Okay, that is the meningocele. Whereas in meningomyelocele, the meninges, basically the meninges, they herniate. The meninges herniate. Can we see that this white, the yellow one, that is our spinal cord. So one is meningocele, one is meningomyelocele. Yes, yeah. Okay, and meningocele, meningomyelocele. So most importantly, meningocele, it consists of CSF filled meningeal sac, could be dura mater, and meningomyelocele will have myelin sheath also. Okay. And remember, again, the spine, this meningocele, the spinal cord will be normal, but there's a fluctuant midline mass that might be trans elimination positive. If I put a torch there in one side, if I take a X-ray film, and if I rotate the X-ray film and put on the swelling and put a torch there, so that will glow. It'll glow. There's a water inside, no, nothing else is there. So trans illuminant positive, this spinal cord swelling. Okay. Yes, very good. And next, this part is done. And very importantly, meningomyelocele. Next is meningomyelocele. So what did we study? Number one, we studied about the what we called spina bifida occulta. Occulta means hidden. It is a swelling which is just like a lower back with a bunch of hairs. There is no swelling, bunch of hair at the lower back. It's an asymptomatic thing, and nothing has to be done for that. It's a midline defect basically, and known as spina bifida occulta. Occulta means hidden. There is a problem with the bone, but it's hidden. There's only bunch of hair, that is spina bifida occulta. In meningocele, very important, the spinal cord is normal, and it's a fluctuant midline mass. It is a midline mass that could be trans illuminant positive. Then comes meningomyelocele. Meningomyelocele. PG entrance question number one. PG entrance question number one. What is the most common location of meningomyelocele? We all know that the most common location is lumbosacral region. Star mark. This has been the first very long, what you called questions. Yeah, exactly. Very good. Okay. Okay. Okay, pancake, we understood pancake. Can we study pancake? Can we continue our topic? Thank you. God bless you. So, the most common location for the meningocele or meningomyelocele is the lumbosacral region. And also remember, in neonatology, what was in the neonatology, I had asked you some skin problem in the baby where the most common location is again lumbosacral region. The answer is Mongolian spot. Mongolian spot. Have you heard of Mongolian spot? Like a bluish patch which fades, which gets disappear, or which fades by 1 year of life. That's another exam question. Can a Mongolian spot fade? Yes, it can fade roughly by 1 year. Like not fully gone, but little fade. Okay. And the most common location for Mongolian spot is lumbosacral region. The most common location for meningomyelocele is also lumbosacral region. And myelo. So meningo means meninges, and myelo means spinal cord. Both meninges and spinal cord protrude into the skin of the back. Okay. For these cases, basically, we get a ultrasound done. For these cases, we get a US. In my hospital itself, from last 3 days, we have a patient of meningomyelocele. This is my patient only. This one. This patient from last 3 days, this patient is with us, and I'm trying myself to refer the patient to other hospital which has pediatric surgery facility, which basically can operate on this meningomyelocele, because it is leaking also. A leaking meningomyelocele is very scary. Okay, it's very scary. And plus this baby is having lower limb what you call hypotonia also. A meningomyelocele, many a times it could be associated with lower limb abnormalities. That also we should know. Okay, and yeah, that's it. This is meningomyelocele, and in meningomyelocele, very important. Yeah, they can develop hydrocephalus. This meningomyelocele patient can develop hydrocephalus. Always remember, see, meningomyelocele patient, this one meningomyelocele, they can have multiple defects. Number one, they can have defect at the lower limbs leading to hypotonia of the lower limbs. Number two, they can have defect in the head leading to hydrocephalus. So they can lead to hydrocephalus, they can lead to hypotonia of the lower limbs, and this is the case of meningomyelocele. Meningomyelocele. Okay, remember that. So number one, they can lead to hydrocephalus with type 2 Chiari malformation. Again, if you're a newcomer, I'll tell you there are two types of Arnold Chiari malformation, type 1 and type 2. Type 2 is the classical, again PG entrance question number 1, which is the classical form of Arnold Chiari malformation. The answer is type 2 is the classical Arnold Chiari malformation. What is this? How does it look like? This and that. Of course, I'll show you image by image in the further videos if you be with me in the full C.N.S. Okay, and so that's it. And meningomyelosis, is meningomyelosis associated with hypotonia of lower limbs? Yes, it is associated. Is meningomyelosis associated with hydrocephalus? Yes, it is associated with hydrocephalus. And there are 80% of chances this patient can develop Arnold Chiari malformation type 2, which is a classical form. What happens in Arnold Chiari malformation? We'll talk about in the further videos. Okay. Yes. Recent question 2017. What is the content of Meningo Seal? ABCD. हाँ जी, RML मैंने RML भी ट्राई किया था, नहीं हुआ। एम्स में भेजा था, किया था, चाचा नेहरू बाल चिकित्सालय CCNBC में रेफर किया था। सफदरजंग also patient himself, we gave a referring slip. Like we don't refer the patient. Normally you don't refer just like that. You make a proper letter, referral note, proper case summary you write basically. We wrote the whole case summary of this patient and sent to AIMS. The patient's father had gone to AIMS and Safdarjung and Chacha Nehru Bal Chikitsahalaya and even RML hospital also. But somewhere the beds were not available and somewhere they said, no, we don't take the case. Like you have to get the patient to OPD and something like that. So we are still waiting. So yes. Content of meningocele, yes, the content of meningocele is dura matter. Meningomyelocele will take spinal cord and not brain matter, not cauda equina. Cauda equina, what is cauda equina? Anyone? What is cauda equina? क्या होता है? क्या है ये? What is so pancake? What is cauda equina? Priya, Anand, Supratik. That's nice. एक होता है प्रतीक. He is Supratik. What is the meaning of Supratik? Supratik. That's nice. That's a good name. I don't know what's your this one. Hanji. Yeah, yeah, exactly. Yeah, you can say that. Steffi is right. Like the horseshoe shaped horseshoe, like घोड़े की वो जो बाल होते हैं, घोड़े के बाल होते हैं ना, like the hair of the horse basically. Cauda equina are like the hairs. You know, the hairs of the horse is there, no? So they're like at the lumbosacral part, the horseshoe shaped or the horse hair shaped bundle of fibers. That is the cauda equina. Okay, that's nice. Okay, so what is the, yes, exactly. Deepak is right. घोड़े की पूंछ, बहुत बढ़िया सवाल का जवाब दिया है आपने। अच्छा, आई वांट टू आस्क व्हाट इज द मीनिंग ऑफ योर नेम? लाइक दीपक, दीपक का नेम आई थिंक हम सब जानते हैं, दीपक, हामिद, and then we have pancake. What is your real name? I don't know. Osama, what is the name? What is your name? Like, what is the meaning of your name? Like, my name is Anand, so I am exactly like my name. I am a delightful soul, I am a happy soul, and I am a peaceful soul. I am a soul who doesn't crib. I am a soul who is chilled out most of the time, and I am a soul who has achieved the reasoning to stay on this planet. So what is your name? What is your name and what is the meaning of your name? Supratik, can you tell me what is the meaning of your name? दीपक तो है ही हमारा दीपक, सबसे प्यारा वाला दीपक, ये हमारा प्यारा सा हमारा दीपक। तो पूजा, यस पूजा, so again पूजा is also nice name, भगवान जी की जो पूजा करते हैं हम, that's nice. Yes. Shubhangi means pure body. Okay, that's nice. So Shubhangi means, so let's discuss about it. Shubhangi means pure body. Okay, you are a pure soul, then you are a pure body. Very nice. Okay. Supratik का मतलब मैं समझा नहीं. I didn't get you. सुप्रतीक का मतलब क्या होता है? मुझे नहीं पता ब्रो, दोबारा बताओ. निशा, your name is Nishi, right? Nishi means night. Okay, that's sweet, that's nice. So Nishi means night. Okay, Deepak is our Deepak, that's nice. Savan is not there online today. Shubhangi means pure body. Okay. That's Doctor and Caffeine. I forgot your name, bro. Doctor and Caffeine. Your name is Sakib. I don't know. Tell me your name again. मैं भूल जाता हूँ. So he said pancake means, what is the meaning of pancake? Diabetes. Yes, that's right. And please remember, in diabetes, the mother will be hyperglycemic and the baby will be hypoglycemic. Remember that. Okay. Yes. Okay, pancake. Okay, your name, beloved of everyone. Okay, beloved of everyone. Okay, that's nice. That's quite a name. Nice. Chaya. Chaya is a very beautiful name. Chaya. Chaya पता है? Chaya एक सीरियल आता था. कौन सा था वो सीरियल? मैं भूल गया. बहुत पहले ना सोनी पे एक सीरियल आता था, बहुत पहले. उसमें उस लड़की का नाम छाया होता था, मुझे उतना याद है. तो दैट्स नाइस. ओके. हाँ जी, हामिद. हामिद, व्हाट इज हामिद? दैट्स अ वेरी स्मार्ट दिस वन. प्रेज वर्दी. सो कूल यार ब्रो. सो नाइस. प्रेज वर्दी, दैट्स नाइस है. मुझे तो बड़ा अच्छा लगा ये नाम सुन के. प्रेज वर्दी, दैट्स राइट. ओके. संधु. अश्विन मीन्स फियर्स नाइट. Sandhu, your name is Sandhu, no? Your name is Ashwin. You're a boy or a girl? I thought you're a girl. Sandhu, right? I don't know. Okay, Ashwin. Ashwin. So who is Sandhu then? You have two names? Okay. Ashwin means fierce knight. Okay, that's nice. That's nice. Chaya means shadow. Yes. Pooja, bodyguard film में भी थी छाया. वो उसमें भी थी छाया. Yes, I remember. Nice name. Good. पर ये हामिद का मुझे बड़ा अच्छा लगा. Praise worthy. प्रशंसा के लायक. Beautiful. Let's move further. Yes. अच्छा ये कोट ही आ गया. So we have this quote again, a motivating quote which says, this is in Hindi. If anyone knows Hindi, nowadays, I'm planning to put Mahabharata quote. पूरा गूगल तो मैंने ख़त्म कर दिया. द होल गूगल इज़ आउट. आई हैव फिनिश ऑल द गूगल कोट्स. सो नाउ आई एम स्टार्टिंग टू पुट ऑन द रामायण एंड महाभारता कोट्स बिकॉज दे आर वेरी टफ टू अंडरस्टैंड बट दे आर वेरी रियलिस्टिक. सो दिस इन हिंदी दिस कोट सेज, कोई कुछ भी कहे बस अपने आप को शांत रखो, क्योंकि सूरज कितना भी तेज क्यों ना हो, समुद्र सूखता नहीं है. तो नाइस. तो नाइस. यस, इट्स अ वेरी नाइस कोट. कोई कुछ भी कहे बस अपने आप को शांत रखो, क्योंकि सूरज कितना भी तेज क्यों ना हो, समुद्र कभी सूखता नहीं है. I think this is self-explanatory. It's a very, very beautiful quote. And you be like that samundra, be like that sea, which never goes dry. Whatever happens to us, we will never go dry. We will always be amazing. We will always be shining. We will always be mind-blowing. We will always be positive, and we will always be our best of the best. Okay? इट्स अ वेरी ब्यूटीफुल कोट. कोई कुछ भी कहे बस अपने आप को शांत रखो, क्योंकि सूरज कितना भी तेज क्यों ना हो, समुद्र सूखता नहीं है. Okay, let's move further. Yes, so spina bifida. So spina bifida, we are covering neural tube defects. We just saw a beautiful picture of spina bifida, occulta, meningo seal, meningomyelosis. Hanji, very true. So which sign? Which sign? Can anyone tell me which sign do you see in spina bifida? I'll give you a hint. Which ultrasonographically sign do you see in spina bifida? So Poonam says, water of knowledge won't dry up. Very true. Very true. Umesh says, don't get yourself in heated comments. Okay, yes, that's very true. That's also right. Pancake says, it's will. मैं समझा नहीं हिंदी में. मुझे समझ में नहीं आ रहा. You send me on IG. I'll see. हाँ जी. So which sign do you see in spina bifida on ultrasonography? Anyone? Poonam, Osama, Pancake. जल्दी बताओ, जल्दी बताओ. Have you heard of banana sign? Have you heard of banana? Have you heard of banana signs? Yes. You see, there are two signs for PG entrance question. We have something known as lemon sign and something known as banana sign. Banana sign. Where lemon is different, bro. Yes, yeah, lemon and banana, very true. So ultrasonographically, in a case of spina bifida, we see this banana. The picture is self-explanatory. Spina bifida में you see banana sign in ultrasonography finding in the brain, of course. No, not the brain, but the body, of course. Spina bifida, banana sign. And where do you see lemon sign? Who will tell me lemon sign? Pooja, Umesh, Poonam. Where do you see? हाँ जी, इमोजी तो भर भर के. ओके, मेरे पास भी है इमोजी. लो, मैंने भी डाल दी इमोजी. वेयर डू यू सी लेमन साइन? हाँ जी, हामिद कहाँ पे है? ओसामा, दीपक, वेयर डू यू सी लेमन साइन? Again, see photographic memory. Now, wherever you will see a lemon, you should ask a question. Make a video, okay? Make a video and send me on IG or WhatsApp. Hello everyone, welcome to Pediatrics by Dr. Anand. As you can see, this is a lemon. So where do you see lemon sign? कौन बताएगा? मैं नहीं बताऊंगा. मैं नहीं बताऊंगा. अच्छा, आंसर किसी ने नहीं बताना, बातें सबने करनी है. आंसर क्या है? The answer is lemon sign you see in ventriculomegaly. Lemon sign you see in ventriculomegaly. When the ventricles are dilated in the brain, when the ventriculomegaly, you will see lemon sign. Okay, ventriculomegaly, you will see lemon sign, and in ultrasonographically banana sign, you will see in spina bifida. In ventriculomegaly, you see lemon sign. Okay, next question. Yeah, this is a very good question. Very, very good question. Anji, so what do you think? This one, what you called? Okay, okay. How do you refer this patient? How do you refer this? This is a very good question. This again such a such a wonderful clinical knowledge we are sharing. I got this patient. You are a pediatrician, and being a pediatrician, you saw this newborn. Okay, the PG entrance MCQ is this newborn with a defect, with a lumbosacral defect. Okay, I'm planning to refer this patient. I don't have a bed available in my hospital. I'm planning to refer this patient to a higher center. So how should I refer this patient? This mother, can you see this mother has got the patient in the clothes? कपड़ों में लेके आई है mother ये baby को अपने पास. This mother has got the baby in the clothes. Like this only, should I just send the patient? Okay, very good. Pancake has such a beautiful answer. Pancake says refer in the ambulance. Of course, Pancake, I will not WhatsApp you and get your car and will not refer the patient together in the car. Of course, I'll get the ambulance. But how should I refer? How should I refer? Exactly. Okay, Doctor and Caffeine says polythene. Doctor and Caffeine, I forgot your name, bro. Are you Sakib? No, I forgot your name. Anji, so this one, should we refer in polythene? Okay. This patient is not having hypothermia. Hypothermia patient, you should wrap up in plastic wraps or polythene. Again, this is a defect. Okay, this is a meningomyelosis. I'm planning to, yes, Sakib, I'm planning to refer this patient. How should I refer it? Still, anyone with a better answer, with a better, beautiful answer? Poonam, Pancake, ऐसे कर दे रेफर, ऐसे ही बस ऐसे ही रेफर जाने दें इसको. Can we send the patient like this? No, you don't refer a patient like that, because if you refer a patient with the open defect like that, it can lead to dryness, it can lead to infection, and it can lead to trauma. So dryness, infection, and trauma are three important things which we it will be a problem. फिर कैसे euro bag covering polythene bags? No, instead of polythene bags, see, this was the question. Ames May 2013, a case of meningomyelocele was posted for surgery. Till the patient is waiting, the covering of the sac will be protected by gauze soaked in. The answer is, anyone? Anyone? Number one, you have to take a wet gauze, or you have to take a gauze piece and you have to soak that thing in what, and do the dressing. The options are normal saline, tincture iodine, methylene blue, and this mercurochrome. What is the answer? Anyone? Exactly, exactly. Very good, very good. The people who have answered beautifully are Pancake, Deepak, Divakar, Sandhu, Steffi, Hamid, Chaya, Priya, and Shubhangi Kaushik, Osama. बहुत सारे, इतने सारे लोग क्यों आए हो? थोड़े लोगों की क्लास थी, इतने सारे तो आने नहीं चाहिए. हाँ जी, द आंसर इज नॉर्मल saline. Yes, in my hospital itself, from 3 days we have having a patient of meningomyelocele. We are calling the pediatric surgeon and even the neurosurgery people, urologist also, basically pediatric surgeon, for dressing you need to cover the sac. You have to take a gauze piece or a pad also, you can take, or a gauze piece, soak that with the normal saline, and then you wrap it up or pack it or cover it nicely, that thing. So protect the defect with the gauze piece soaked in normal saline. Ames May 2013 question. Okay. Pagoda bag, I think it's for the colostomy bag. No, I think I took a class of that also on C.N.S. We have a, acha, remind me, once we finish this C.N.S, no, I have 100 MCQs already. I have made of the rare questions on C.N.S examination. तो उसमें Bogota bag मैंने रखा है. I think the colostomy bag is the Bogota bag. I will just check it again. But right now, this is not Bogota bag. This is a normal bag, which we should know. This, you cover the meningomyelocele by taking a taking the gauze piece and soak it with normal saline. Done. That's what. So meningomyelocele is covered with the sterile saline soaked gauze to prevent from dryness, trauma, and infection. Has everyone understood this much? Please put a like button if you're able to understand, or a semi like button, or a heart, or anything, you know. Okay, perfect. Next. Acha, this is important now. Remember this. Okay. I said a heart. In दूध की बोतल किसने डाली है? Milk. Someone has put a milk bottle. Okay, milk bottle. How much kilocalories? Each 100 ml of breast milk contains how many kilocalories? Who will tell me? Each 100 ml of breast milk contains how many kilocalories? अब बॉटल डालिए दूध की तो हाँ जी ओके हाँ जी each 100 ml of breast milk contains 65 kilocalories. Number one. How many gram of proteins? 1.1 gram of proteins. How many gram of lactose? ये मैं नहीं बताऊंगा. ठीक है. Each 100 ml of breast milk contains how many gram of lactose? Who will tell me? No option. सर ऑप्शन बता दीजिए सर. मैं ऐसे लिख दूंगा. ऐसे नहीं है ऑप्शन. आ गया मैं ऑप्शन. मैं ऑप्शन को राजमा चावल में मिला के खा गया. नहीं है ऑप्शन मेरे पास. अब कौन बताएगा? Each 100 ml of breast milk contains how many gram of lactose? मुझे याद नहीं है. Who will tell me? Steffi, Pooja. Yes, pancake is right. 7.4. So remember 7.4 and 4.7. Each 100 ml of breast milk contains 7.4 gram of lactose, whereas each 100 ml of cow's milk contains 4.7 gram of lactose. So 7.4 and 4.7 is that you should know. How much? Okay, I think that's enough of this one. Okay, so remember please, meningomyelosis in the lower sacral region leads to bowel and bladder incontinence. This today my HOD was asking. Today morning we had very long rounds in NICU, and this patient of meningomyelocele itself, my HOD had asked that Anand, this meningomyelocele patient, what all problems it can lead to? I said, sir, it can lead to hydrocephalus. He said yes. Sir, it can lead to type 2 Arnold carry malformations. He said yes. Then I said, sir, it can lead to hypotonia of lower limbs. He said yes. Then I said, it can also lead to bowel and bladder incontinence. He said yes. Okay. Then he asked me another 5-6 question which I didn't understand. Then he asked me what is ATD angle in Down syndrome? In Down syndrome, what is ATD angle? Have you heard of ATD angle? ATD angle in Down syndrome. कौन बताएगा मुझे? Anyone? Hmm. Yeah. So, okay, Pooja, the what do you call breast milk or the colostrum is rich in IgA. IgA. Remember, the predominant immunoglobulin present in the colostrum, the first feed, is nothing but IgA. IgA. And here again a connecting question in Hinong-Schönlein purpura also. In a case of what you call small vessel vasculitis, Hinong-Schönlein purpura, there is predominant IgA deposition. IgA deposition everywhere in my body. So in Hinong-Schönlein purpura also IgA, and in breast milk also IgA. Okay. Yeah, in the breast milk, cow's milk, I don't know, breast milk it is IgA. Anji, what is ATD angle in what you called Down syndrome? That's a homework. That's a homework for you. What is ATD angle in Down syndrome? If anyone wants to know, later revise it. Today 8:30 we have a class. Let me know that time what is ATD angle in Down syndrome. Okay, next question. Yeah, so that's what, hydrocephalus can be seen in a case of meningomyelocele, neuropathic bladder. I told you urinary incontinence and all that. It can be seen areflexia, hypotonia. These all three conditions are seen in my patient in my hospital. That you should know, and that's it. And spastic limbs also. Spastic limbs are not seen. You see hypotonia, not spasticity, not rigidity, hypotonia. Okay, and the book says that there is no impairment in the motor function. Muscle will be okay. There is no impairment in the motor function in the meningomyelocele. Done. Yes. Next important question. So 5 more minutes, then this class is over. What is this? Next neural tube defect. We have a very list of beautiful neural tube defects with beautiful explanation. What is this? Anji, what is this? What do you call this? Is this the anencephaly? I don't know what is this. No idea. Never heard about it. What is this? Pancake? Poonam? कल्पना, पूजा, छाया, दीपक, क्या लग रहा है आपको? क्या लिख के आएंगे आप? हाँ जी, क्या ये सिनी का छोले भटूरे? योर आईडी इज छोले भटूरे? सीरियसली? ओके, दैट्स नाइस, वेरी गुड. मैं तो संडे को ही खाता हूँ छोले भटूरे, भी अगर मन करे तो. Andy Walker malformation, no. Encephalocele, yes. The best answer for this question will be encephalocele. Encephalocele, like a protrusion at the lower back, sac-like protrusion of the brain and membrane. So can we appreciate what are we studying? Neural tube का defect. There is a defect in the neural tube. Normally, neural tube forms the brain and spinal cord. So if the neural tube defect or the neural tube is not closing or incomplete closure of the neural tube, if the neural tube is not closing at the cephal portion, at my head portion, it can lead to something known as anencephaly, which is the brain problem. I will show you the picture. It can also lead to something known as encephalocele. It is a very important image based question. What is encephalocele? And that's what this is, the encephalocele. Real patient picture, real patient picture of encephalo. Can we appreciate this, yes or no? Can we thanks our patient who can help us out? This is a, can we see that a sac protruding behind? This is encephalocele. Okay, you can see, yeah, occipital encephalocele with anencephaly. Like this patient is having an absent head also, like an absent calvarium. Anencephaly. Can we see the head is very very chotu, very small, and I'll show you a proper picture of anencephaly. One second. Let me, yeah, this one. Can we see that? What is this? This is a typical picture of anencephaly. This is a very typical picture of anencephaly. This, what is this, anyone? This is a picture of anencephaly, absent calvarium. This is a picture of anencephaly, absent calvarium. This is a picture of anencephaly, absent calvarium. So these are the important pictures of the anencephaly, or what you called absent calvarium. Anencephaly, absent calvarium. Okay, done. Can we move further? Yes or no? That's what. So it's all surgical correction, dear. Like anencephaly is a case of DNR. Anencephaly, if the this is not there, anencephaly, it's a case of DNR. What is DNR? Anyone? What is DNR? Have you heard of DNR? Exactly. What is DNR? Pancake, Pooja, Abhi, Majumdar. Okay, are you the son of the this one, the big Dr. Majumdar? Hanji. What is DNR? DNR, yeah, exactly. Pancakes, right? DNR is do not resuscitate. Do not resuscitate. My HOD always say that whenever this patient comes, no, like this not my HOD, one of my favorite ma'am, Dr. Nidhi. She's DM, what do you call it, neonatology from MEMC. MBBS from MEMC. MEMC is Maulana Azad Medical College. She's MBBS from there. She's MD from there. Then she has done her SR-ship from Lady Hardy Medical College. Then she did her DM from MAMC. Now she's at my hospital. So as a consultant, so she told me, Anand, if you see any case of anencephaly, or if you see the cases of what you called a severe form of neural tube defects, they are DNR. Do not resuscitate, because these babies are not compatible with life. These babies are not compatible with life. Any baby who is born with a case of anencephaly or a severe neural tube defect and he's breathing, these babies, always remember, these babies are always very 500 grams, 400 grams, 300 grams, like that only. Okay. And if they are born with life, with little heart, you give them comfort care. You give them comfort care. Comfort care is something we need to know. Comfort care matlab just do not intubate and ventilate and this and that, because they are not compatible with the life. Anji pancake, yes, Dr. Nidhi. If you want, I'll show you a picture also. Okay. Yeah. Very nice neural tube defect. ठीक है, 2 more minutes and this class is over. हाँ जी, ये क्या है बताओ? This is the PG entrance question number 1, which is the most severe form of neural tube defect. Which is the most severe form of neural tube defect, or which neural tube defect has the worst prognosis, or which is the most severe form of neural tube defect. So what is the answer for this question? It is one of the rare anomaly where the brain and spinal cord is fully exposed. Where the brain and spinal cord is fully exposed. Exactly. Pancake is very right. The answer is craniorachis. The answer is craniorachis. PG entrance question number 1, which is the most severe form of neural tube defect. The answer is craniorachis. Can we appreciate that the full brain and the spinal cord is fully exposed? The brain and the spinal cord is fully exposed. And I have seen the real patient. I remember when I joined my hospital, I'll show you this one called second picture. Yeah. So what is this case? Anyone? What is this? छोले भटूरे तुम कहाँ से हो, पहले ये बताओ, तुम उससे पूछ रहे हो वो कहाँ से है. हाँ जी, कैन वी सी दैट? व्हाट इज दिस? सो दिस इज नथिंग बट अ वेरी सीवियर केस ऑफ दिस वन. कैन वी सी दैट? व्हाट इज दिस? एनी रैंडम गेसेस? व्हाट इज दिस? व्हाट डू यू कॉल दिस? क्या है ये? This is nothing but craniorachis. Can we appreciate that the whole brain and spinal cord is fully exposed? Yes or no? The brain and the spinal cord is fully exposed. This is a severe form of craniorachis. Remember that, okay? This one is nothing but craniorachis. This was the first patient I remember. I joined the hospital. Next that day only they said it is a labor call and senior को बुलाया है. There's a senior is required for this delivery. Please come fast. And I went and I saw it was a case of craniorachis. And I was like, no one was able to diagnose, but I said, "Ayyo, this is a case of craniorachis." Like my theory was okay, so that's why I was able to This is craniorachis. This is craniorachis, है ना? So this is what. That's why we always say that photographic memory is everything. You look at the patient and tell the diagnosis. Look at the patient and tell the diagnosis, and that's how your clinical knowledge will improve. That's it. Thank you so much everyone for this wonderful participation. 1 hour is over. ये class यहीं समाप्त होती है. And see you at 8:30 p.m. I'll go for a good run and see you at 8:30 p.m. And before leaving, let's see if you have any motivating quote. 1 second. So these are questions we're going to cover in our what you called upcoming classes. So that's it. Take care of yourself, everyone, and be happy. And that's it. We have covered a very beautiful part of the what you called this one neural tube defects. And 8:30 let's meet up. And again, before leaving, a very beautiful quote we need to remember again. This person says that this is 6 and the other person says that this is 9. So just because you are right does not mean I am wrong. You just haven't seen life from my side. So this is one very beautiful perspective of life. Thank you so much everyone. क्लास ओवर ऑलरेडी भैया 1 घंटा 10 मिनट हो गए. कितनी लंबी क्लास चाहिए तुम्हें? 1 hour 10 minutes is enough for one segment. 8:30 we will start the class again. 8:30 we will continue the slides on the neural tube defects and we will finish this topic now. Thank you everyone. Thank you Nishi. Thank you. Take care everyone. See you 8:30. 2 घंटे बाद मिलते हैं.